Good afternoon, this is Dr. Chris Ebert-Santos at Ebert Family Clinic. Today we're going to talk about the good news and the bad news about COVID and children, based on information from the experts at Children's Hospital of Colorado in a meeting held last Thursday. So one of the very good news is that few children become sick with the coronavirus disease. Less than 2% of cases have been in children under 18 years old. So that is good, and that means we probably won't be thinking about testing vaccines for children for the next year or two. The priorities will be the more high-risk older people. The bad news is 30 states showed an increase in coronavirus cases today, as reported in the news. So we still have to worry about the grandparents. We still have to be very careful about traveling, wearing masks, social distancing. Another piece of good news is that the main way of catching COVID is not from passing people on the streets who are visiting our resort community, but it is household transmission. And it's a one-way street. Children are very unlikely to infect the adults. It's the adults who infect the children and other adults. So another piece of good news is that the American Academy of Pediatrics does recommend that we reopen the schools in the fall because children are at such a low risk of having COVID. We just have to keep the teachers safe. An analysis of the data from Sweden, where they did not close schools, also reaffirmed that there was no increased cases of COVID for those children who continued to attend schools during the COVID period. Another piece of good news is there were only 3 cases in Colorado of the multi-inflammatory syndrome in children that is related to a previous COVID infection. So we're not going to be terribly worried about that, although I do still get some calls on children who have diarrhea or vomiting or stomach aches, since that is one of the symptoms there. That is our update today, and thank you for checking out our Facebook site. Please call if you have any questions or pass us a text, and check out our blog on COVID and the altitude, highaltitudehealth.com.